Let's talk about common mistakes
Okay.
that we see where one might think or conclude that the AIP diet didn't work for them. And I'll start first. We can take
Okay.
turn and just share what we see with
Okay.
clients.
Yeah.
But the first thing can be not giving it a chance for long enough. So trying eliminating a food for a week or 2 weeks doesn't necessarily make so much of a difference, depending what's going on with that person and how inflamed they are and what they
Yeah.
replaced those foods that they took out with those with what new foods but not giving it enough, a chance is one common mistake. What about you?
Absolutely. I think something that I've seen is not recognizing, for example, if gluten would be something that would be taken out, not understanding how gluten can be named on food labels,
So
for
not
a lot of,
removing the food, no,
yeah,
thinking that
it's
you had, but you haven't.
but you haven't. So it's not it's moving forward where you start seeing the value in looking at that food label and understanding what you're looking for. So that's a common mistake
Yeah,
that I've seen.
yeah.
Um, Another one, and I suppose this is a tricky one, depending on which version you are following, but also the exclusion of salt, pepper. The spices can be really, really difficult. But if we take nightshades, for example, and that's something that you've looked at taking out, it's understanding the link of the nightshade to the spices. And so
And
actually what
supplements as well.
absolutely,
Yeah.
absolutely, and recognizing that a lot of those spices that you thought you could maybe have are actually linked back to that nightshade family. So understanding that you've got to look at both from that point of view as well.
Some may be having, particular supplements, adaptogens to support the adrenals that are, not AIP friendly. So always cross-checking your supplements, are they AIP compliant? Because otherwise, if you're somebody who is really, really reactive, that could be
Yeah,
enough to keep you
absolutely.
symptomatic.
Absolutely.
Um, what about jumping into, those personality type who are all or nothing?
Mm.
And they jump into the elimination phase, which can be done, absolutely. It can work for many.
Hmm.
But if you're drinking coffee, if you've been a
Yeah,
coffee drinker and your body is relying of that caffeine hit, it's coming. So there's going to be an element of caffeine withdrawal, which can
absolutely.
cause more issues, more fatigue, more headache, more brain fog.
Yeah,
If you go from a standard diet, then not factoring in where are you getting your carbohydrate from? Because if you choose the most strict version of the AIP diet, the core AIP, you really have to think carefully about where your carbohydrates are going to be coming from.
absolutely.
And so
And
you can go really low carb. And
yeah, absolutely. And with that, then you see the fatigue and you can start seeing cravings, you can start seeing the potential effects on your blood sugar.
yeah,
And
the
so
brain
it's
fog, dizziness, all the things that will make somebody feel terrible.
exactly. And then, there's that thought, well, what have I done? This is just not for me.
Yeah,
This is something I've got
yeah.
to stop. And it's not necessarily the case. It's just there's a way that we can do it for you.
And just, this is where the value of working with a practitioner who understands this dietary approach
Yeah.
is invaluable because doing it on your own can be really, is doable, of course,
Yeah.
but you really need to do your homework and your research and really understand the nutrition and the diet and,
Yeah.
and any sort of traps that you might get yourself
Absolutely.
stuck in and do that detective work, right? This is how I'm feeling a few days in, a day in. Why is that? And being able to unpick and understand,
Yeah.
it's not always that straightforward when
Def Definitely. And also understanding that the cravings that you might be feeling, they will pass. So there's that phase that, maybe 2 weeks or so that for some people, they just have to push through. You will get there and you
yeah.
will start seeing the benefits and the rewards of it. And, I've done it myself. It's not, I've gone that core, I've gone sort of the core route and I'm a nutritional therapist. It can be incredibly difficult and pushing
Yeah,
through towards those that 2 week mark. It can be hard.
yeah,
I feel for people that are moving forward with it, but also I know what's there at the end. So,
The
you know, you
reward can
just
be incredible
absolutely,
if
absolutely,
if you manage those early days and you do it in a way that works for you. Because
definitely.
let's not, for me, one of the biggest elephants in the room is the histamine.
Yes.
My issue, I suppose, as an AIP certified practitioner, is that there is a big push on rebuilding, supporting the gut microbiome whilst implementing the AIP diet. So that's going to look like all of the fermented foods. That's going to
Yeah,
look like the everything fermented, the kefir, the sauerkraut, the kimchi.
definitely.
If you have a histamine issue, that's going to make you feel so much worse.
Yeah, it's not going to be the way to go forward, is it?
No.
When you've got that
So
histamine issue.
often my approach of the AIP diet for a client is going to be reduce histamine. I'm highlighting those foods that are high
Yeah,
histamine on
yeah,
those, allowed food lists, because histamine is a really big issue that is not well understood or commonly
yeah,
picked up by both the
yeah,
individual or the practitioner. But we really need to be accounting for, and also going easy, like everything, if you're going to be introducing new foods that you were not consuming before, it's ease yourself in, see how you tolerate it, just let your gut
absolutely.
time to adapt
Yes,
to
and
the change of diet.
the way that you processing this whole change
Yeah,
opportunity as well. Give yourself
yeah,
that opportunity as well, definitely. And
yeah.
like you say, histamine can be such an issue for some people who do follow this diet. So, you know, there are ways that we can overcome that. And so, again, it's just working with people who can help you through, you might see the greatest rewards.
Because again, the diet is not the end all.
No,
So
there's four pillars,
whilst
right?
right is it's one of the pillars, and
Mm,
it's a mean to typically, like we said at first, bring inflammation down to a degree, identifying if foods are even part of the picture, because not
mm.
everybody with chronic inflammation, autoimmune disease has a broken gut barrier.
Yeah, yeah,
And not everybody is impacted by the foods that they eat. Most people are going to see some relief,
yeah,
but some might not. Um, and then if you do get some relief from an elimination diet, what are you doing about rebuilding, sealing that gut if it has become leaky, so to
yeah,
speak? What are you doing to identify what has led you to develop this
yeah,
leakiness of the gut in the first place?
absolutely.
You don't just want to take away and stay in the elimination phase
No, but
forever.
definitely. And I think that's the thing to really, really hone in on and focus on if you are following or this diet is look at everything you can have. Try not to focus on the things that are being taken away because there's a whole world
Mm,
out there from a food point of view. There's so many new opportunities to try different things and develop the tastes in different ways. So there are so many things that we can focus on and really just focus on that group of what we can include because there's some beautiful foods within it. But also, with that said, like you've mentioned, there are other areas for us to consider. So, you know, if food wasn't that original trigger, how are you supporting if stress is your issue? How are you
yeah,
supporting that sympathetic nervous system? And getting yourself into that parasympathetic state. How are you supporting your sleep? How are you
yeah,
sleeping in the first instance?
yeah,
You know?
yeah.
So it's
Because
it's
again,
really
the
looking at
AIP is not just about the food,
yeah,
actually. It's a
yeah,
protocol, and it's about looking at all those pillars.
exactly.
And for some, the support system around the individual, you've
Definitely.
talked about stress, you talked about sleep,
Yeah,
movement is important.
absolutely.
And so not just being hyperfixated on the
Yeah,
diet
yeah,
and, pushing yourself to the extreme with not factoring in sleep and working out every day and not allowing time for rest and being,
absolutely.
because can't imagine that anybody would see any significant degree of relief in symptoms if that's how they're living their life.
Definitely. You've got to see things as a whole.